Welcome to this training program on Ebola preparation in HCA facilities. My name is Jane Englebright. I'm the Chief Nursing Executive and the Patient Safety Officer for HCA, and I'll be your narrator for this program. HCA has a long history of emergency preparedness and emphasis on patient safety. Our approach to identification, isolation, and treatment of Ebola virus disease has challenged us to focus with increased diligence on prevention, early recognition, immediate isolation, and meticulous use of personal protective equipment, or PPE. Key practices for containing the exposure and transmission risk associated with Ebola virus disease, or EVD, include the following 5 elements. A first point of contact screening for patients who present to care at any HCA site, immediate implementation of isolation precautions when a positive screen is identified, for example, travel with symptoms of EVD, or exposure to a person who is known to have Ebola. Advanced planning to make personal protective equipment immediately available for staff performing the first point of contact screening, including in emergency departments and patient admission areas. Application of a mask and placement of the patient in a private room with initiation of standard, contact, and airborne precautions. Note that HCA does recommend full airborne precautions, which is a step above what's currently being recommended by CDC. And finally, to utilize appropriate PPE that is readily on hand for patients at high risk or at some risk for Ebola. PPE prevents staff from having exposure of skin or mucous membranes to the patient's blood or other body fluids, secretions, or excretions. Jewelry, fingernails longer than the fingertip, and hair outside of the cap may increase the risk of a breach in protection. Practitioners should minimize these risks before putting on their PPE. All persons entering the patient room should wear full PPE. That includes disposable bouffant head or hood cover, a face mask or N95 respirator. Again, HCA recommends that you use the N95 respirator when available. Face shield or goggles, and impervious full-body gowns. Leg boots and shoe covers that extend to the knee. Usually these are one piece and are called boots, high heel shoe covers, or waders, and 2 pair of gloves that are double gloved. This is a picture of a caregiver in full PPE. Notice that there are no gaps from any angle. Before engaging in patient care or entering the room, the integrity of the PPE should be evaluated by a trained peer who confirms that the PPE has been donned appropriately by the staff and that there are no gaps or breaches in protection. Careful removal of PPE is important to prevent inadvertent exposure to patient blood or other body fluids, secretions, including respiratory droplets or excretions. A special note that these steps are different from past practice, and they are sourced from the WHO-CDC infection prevention recommendations for African healthcare settings. The key points for removing PPE are: remove PPE at the doorway of the patient room or in the anteroom. Have a trained peer or a buddy assist with careful removal of PPE. The buddy also wears PPE and will remove their PPE following the same procedure. Step 1. Remove the outer pair of gloves. Consider wiping the gloves with bleach wipe, or PDI, prior to removal if they have been exposed to body fluids. Grasp the outside of the glove with the opposite gloved hand and peel off. Hold the removed glove in the double-gloved hand. Slide fingers of the single-gloved hand under the remaining double-gloved hand at the wrist. Peel off the glove over the first glovelet. This is the surgical technique of roll or double fold. Discard the gloves in a biohazard waste container. Step 2. Remove the gown. Using the second inner pair of gloves that remain on, unfasten the gown ties. Remove the gown by pulling it away from the neck and shoulders while not touching the inside of the gown. Turn the gown inside out or roll it down from the top down, creating a bundle for discarding where the contaminated side of the gown is not exposed. Discard the gown. Remove the leg shoe covers by rolling them down, starting at the top. Discard the leg covers. Step 4. Remove the second inner pair of gloves using the same technique as the first pair. Perform hand hygiene, including the wrists. Step 4. Remove the second inner pair of gloves using the same technique as the first pair. Perform hand hygiene, including the wrists. Step 5. Don a clean pair of gloves. Step 6. Remove goggles or face shield. To remove, handle by the headband or earpieces, using caution not to touch uncovered hair or skin. Step 7. Remove the respirator or mask. Step 8. Remove the head covering. Step 9. Remove the gloves using the same technique as on the other pairs. Step 10. Perform hand hygiene before leaving the room. If inadvertent exposure to patient blood, other body fluids, secretions, including respiratory droplets, or excretions, despite meticulous PPE application and removal, the employee should immediately rinse mucous membranes or wash or shower with soap and water. The exposure should be reported to your supervisor, infection preventionist, and employee health for monitoring, including fever checks for 21 days after the exposure. Diligent screening and immediate isolation of patients are foundational to our focus on preventing the spread of acute communicable disease. Thank you for all that you do to care for our patients. Additional information will be shared as we learn more about these latest challenges. For additional information, visit these resources that are available to HCA staff: the link to our emergency preparedness site on Atlas, and the Lippincott Skills and Procedures resource that's available to all of our facilities. Please note that the actual supplies that are used for PPE in your organization may be slightly different than those pictured here in these demonstrations.